with the patient lying down, head back. Expose the patient's neck as much as possible. This location of the laryngeal node is also the location of this thyroid cartilage. We perform a sliding scan underneath the thyroid cartilage. The entire isthmus of the thyroid can be seen. The thickness of the isthmus could also be measured. At the same time, you can also see the two bilateral lobe cross sections. We are now scanning the isthmus from top to bottom until it disappears. For the upper side, we can do a transverse and longitudinal scanning. In the transverse section, we still go directly under the thyroid cartilage. And then we translate and scan the right side of the patient's neck. When moving on the right side, it shows the right lobe of his thyroid. Then we slide the probe up and down to scan until the right lobe of the thyroid disappears. Then we can observe the whole right lobe. Check echo uniformity to see if there are any lesions. At the same time, the common carotid artery should also be in our image. After the right side, now we slide the probe the left side. Then do the same. Slide our probe up and down to examine the left lobe of our thyroid. You can see this area. There is a small cystic occupancy. After the transverse section, we'll do a longitudinal section. In the longitudinal section, at the lateral lobe of the thyroid. When the transverse section is the largest, rotate the probe clockwise. At this time, we can see the largest section of our lateral lobe. It is also in the longitudinal section to measure the thickness of the lateral lobe of the thyroid. Now we can look at the thyroid blood flow. The blood flow is also very full.